Hello students, in today's video I am going to discuss about radiology on upper limb and lower limb. So in this video we will discuss how to read the X-rays and what are the most probable questions from these slides. So let's discuss one by one. Now this X-ray is there, you have to speak that this is the X-ray of shoulder joint and it is a antero-posterior view. Most of the time you have AP X-rays and very less you will have PA views. Now in this X-ray, how to read this X-ray? Now you should have idea about the articulation of your bones. Now here you can see that this is a shoulder joint. So you definitely have the head of humerus, you will have the glenoid cavity, you will have this laterally your greater tubercle, anteriorly you will have the lesser tubercle, above this projection is known as acromion process, anteriorly this is known as coracoid process, this is clavicle, this is your body of scapula. Now if you will see all these bony landmark in this X-ray, how to identify? So what is this? This is your head of humerus and this is your glenoid cavity. So this is your shoulder joint. Clear? Apart from that, this lateral aspect, it is showing this projection. Now what is this? This is your greater tubercle. Lesser tubercle will show the superimposed view because it is present anteriorly. So here roughly you can see that this is the area of your lesser tubercle. Now apart from that, this, what is this? Now this is your coracoid process. Now here you can see that this is your acromion process and this is your clavicle. So here you will have one more joint, this is known as acromioclavicular joint and this is your shoulder joint. So sometimes you may have this question, how many joints are visible in this X-ray? So two joints are visible. What are the types of the joint? It is a plain synovial joint, it is a ball and socket synovial joint. Now sometimes you may have the question that which muscle arises from this. So this is the tip of coracoid process. So you should reply that you will have the short head of biceps and coracobrachialis. Sometimes you may have the question that which muscle attached on this greater tubercle or on this part of the X-ray. So what is the muscle you will have? You will have supraspinatus, which is the most prominent muscle which is attached on this part of your greater tubercle. Now if you will have this question, which muscle attached here? So this is your lesser tubercle. So which muscle comes here? It is the subscapularis. Clear? So in this way you may have the questions regarding this X-ray. Clear? Now we'll move to the next X-ray. Now this is the X-ray of your elbow joint. Now rather than speaking the lower end of humerus, upper end of the bones of forearm, we use the word that it is a X-ray showing the articulation of your elbow joint. Now in this elbow joint, what you are able to understand, now here you can see the articulation. Now you know that this is the lower end of humerus. Now here you will have this round structure is known as capitulum. Below the capitulum, this is the head of radius, this is the neck of radius, this is the shaft of radius, this is your trochlea. Now below the trochlea you will have the ulna bone. On the side, this is your medial epicondyle, this is your lateral epicondyle. Here you will have the tuberosity of the radius is known as radial tuberosity. Now these features you have to identify in this X-ray. Now the most common question is that what type of joint is visible here? So this elbow joint is a classical hinge joint. Apart from that, this joint is your superior joint between the radius ulna and it is a pivot variety of joint. So what questions you may have that what is this? So this is your radial tuberosity. Now which structure attached here? You know there is a insertion of the biceps brachii. Now apart from that, what is this? This is your neck and this neck is surrounded by which structure? Answer is annular ligament. Now you may have the question, what is this? Now this is your medial epicondyle because this is ulna. This is your lateral epicondyle. Now this round structure is known as capitulum and this part is known as trochlea. Clear? Now dear students, in such a way you may have the questions on this bone. This is your olecranon process. If you will trace, you can see this part of the ulna which is visible behind the bone. Clear? So these are the important features and the questions you may have. Clear? Now we will move to the next part. Now this is the X-ray again of the elbow joint, but this is a lateral view. Clear? Now in this lateral view, where you can see this. Now, when you will take the lateral view, if it is a flexion, semi-flex elbow, then you will have this horizontal forearm like this. So, this is a lateral view of my semi-flex elbow. Now, in this image, you have to keep this thing in mind that this round structure is what? Now, this round structure is your capitulum. Now, here this is your capitulum. Now, below the capitulum, you will have this head of radius. So, here this is the head of radius which is visible here. Now, again the question will come about this projection. So, what is this projection? This projection is your radial tuberosity. Clear? So, in this way you may have the question on this also. So, what is this? This is your humerus, and what type of joint it is? So, it is again a elbow joint, is a type of hinge variety. Now, here you can clearly see this is your ulna. You can see this olecranon process. So, question may be asked that which muscle attached on this bony area. So, you have to identify that this is olecranon process, and here you will have insertion of triceps muscle. Clear? So, in such a way the questions may be asked in your exam. Now, we will have the next slide. Now, this is the slide which is showing the complete forearm, because you are able to see both the joint, upper joint and the lower joint of the forearm. So, again the questions are same, what type of joint these are. So, what type of the joint it is? It is again upper part is elbow joint, is a hinge joint, lower part is a wrist joint which is a ellipsoid variety. Apart from that, the radio and ulnar joints which are visible, these are your pivot variety of joint. Clear? Now, you may have the question of the same type, that what is this bony projection, what is this bony part. So, this is olecranon process. Now, this is your radial tuberosity. Clear? In the same way, you will have the lower end of your forearm bones. So, if you will track this, this is your shaft of the ulna, this is your shaft of the radius. Now, if you will see this, you will find that this is the lower end of your ulna and this is your lower end of radius. Clear? And these are the carpal bones. So, such type of questions may be there from this slide. Now, next question is, now this is the Xray of your wrist. Now, apart from the wrist, your bones of palm is also visible. Clear? Now, in this X-ray, if you will see the image, you will find that you are taking the X-ray from back. Clear? So, you are able to see the dorsal surface of the bones. It is not the X-ray from the anterior side, it is the X-ray from the dorsal aspect. Now, why I am saying this? Because you can see that this sesamoid bone is visible on the anterior aspect of this first metacarpal. Clear? Now, this is the same picture here. You can see that this is the sesamoid bone is visible here. Now, apart from that, the lower end of these forearm bone will also give the idea that this is not the anterior surface, this is the posterior surface of the lower end of radius. Now, what questions you may have? You may have the questions that what type of joint these are. So, these are the interphalangeal joint which are classically hinge variety of joint. Clear? Now, here you will have, this is the convex and concave joint. So, what is this? This is again ellipsoid variety of joint. Now, here sometimes you may have identify the styloid process. So, this is the ulnar styloid process. This is our radial styloid process. Which muscle attached on the radial styloid process? Answer is brachioradialis. You may have the question that what type of joints are intercarpal joints, what type of joints are formed between the carpal bone and the radius, which bone is not participating in the wrist joint. Clear? Now, see, this is your lower end of the radius, and you know that lower end of radius is having the depression for the two bone. Now, what are that? Scaphoid and lunate. So, this is scaphoid, this is lunate. So, in such a way, you have to identify the bones in this X-ray film also. Clear? Now, we will move to the bones of lower limb. Now, in the lower limb X-ray, you will have this X-ray of hip joint. Now, you cannot say it is a pelvis. Why? Because it is a half of the hip bone is there and the upper end of femur is visible. So, it is not the X-ray of pelvis, it is the X-ray of hip joint. Now, here in this, what you are able to see, this is head of femur, this is your hip bone, this is your part of the femur, this is greater trochanter, this is lesser trochanter. Now here you can see that this is your ischial tuberosity which is visible here, this is part of pubic symphysis is visible. So this is anterior superior iliac spine. So in the same way you have to identify same structure here. So you may have the question that identify this structure and name the muscle insert here. So what is this? This is the greater trochanter of femur, and which muscle attached here? You will have gluteus medius and minimus. Now what I identify this? This is the lesser trochanter. Which muscle insert here? Iliacus and psoas major. What type of joint it is? So it is again a hip joint, is a synovial joint. What type of synovial? Ball and socket type. Now here you will have that this is what? So this is the ischial tuberosity. Which muscle arises? So answer is hamstring muscles will arises. Clear? Now you will have this. What is that? This is the obturator foramen. Now you will have the question muscle attached here. Now such type of, what is this? Now this is your pelvic inlet. What is that? Pelvic inlet. Now such type of questions may be asked from this X-ray. Clear? Now we'll move to the next question. Now this question, this slide is showing our X-ray of knee joint. Now this is your knee joint which is showing that this is lower end of femur, upper end of tibia, and on the side you will find the this part is your upper end of fibula. But fibula is not the part of knee joint. Now this is a type of superior tibiofibular joint which is a plain variety of joint. Now apart from that, this is your patella. Clear? And here you will have the menisci which is visible here on the upper part of tibia. Now if you will see same thing here in this X-ray, sometimes the question may be about this space. Why there is a space is seen in the knee joint? Your answer should be because of the presence of menisci, and these are the cartilaginous structures, so they are not visible very well in the X-ray, and that's why this much of joint gap is visible. Clear? Now what type of joint it is? So I just told you this is the superior end of fibula and it is a plain variety of synovial joint. Now you may have the question that where is the patella? Now you have to understand that I just told you that patella is here, it is not occupying the anterior surface of tibia. So here if you will see very carefully, you are able to see the margin of patella. If you will see very carefully, you can very well appreciate that it is a margin or outline of the patella. So you may have the question that which type of bone it is. So it is the largest sesamoid bone of the body. Clear? So what type of joint your knee joint is? So knee joint is a modified hinge joint or it is a condylar variety of joint. So in such a way you may have the questions. Sometime you may have the questions regarding the muscles also, if you will have the point, some particular points like what condyle it is. So it is a lateral condyle of the femur, and you will have the question name the muscle on the lateral surface of the condyle of femur. So such type of questions may be asked from this X-ray slide. The next slide is, now here you will have the ankle joint. Now this is your ankle joint. Now in the ankle joint you are able to see this is the lower end of tibia, this is the lower end of fibula, and which bone is this? Now this is your talus bone, because this is known as ankle mortis, and ankle mortis articulate with the superior surface of talus. Now in this you will have this medial malleolus, and here this is the lateral malleolus. Apart from that you are able to see some bones of your foot. Now here also in this image you will have the question that identify these bony points. So what is this? This is the medial malleolus, this is the lateral malleolus. Now what type of joint is this? Now this is the inferior tibiofibular joint and it is a syndesmosis. Now what type of joint? Now what bone is this? Now this is, I just told you, it is the talus. And what type of joint it is? Now here you will have again the ankle joint, which is a classical hinge variety of joint. Clear? So such type of questions will be there in your exam about the bony markings of different bones. This is the one more X-ray of the foot. Clear? Now in this what you are able to see, now this is your great toe. Then you will have the fingers of your foot, or you can say remaining toes. Now again the question is identify the bones. The most common question you will have identification of bones. Now here you can see that these are the two sesamoid bones which are present near the distal head of first metatarsal. So this is your first metatarsal. Near the distal end you are able to see the two sesamoid bone. Apart from that, now here which are the bones are there. Now here you can see that this is your anterior part of talus. Clear? Because it is a superior view, so this is your talus bone. Now this posterior projection is calcaneum. In this the posterior calcaneum is not visible. Now this is your navicular bone which is making a joint with the head of talus. So this is your navicular bone. So you will have the question, identify this bone and name the muscle insert on it. So this is your navicular bone. Clear? Now anterior to the navicular, these are the three cuneiform. So these are the three cuneiform. Now this is your cuboid. Clear? So this is your cuboid which is present on the lateral side. So in such a way you have to identify the bones, or you can say tarsals. Clear? So in this image you can see that you have to first very clearly identify the head of your talus. Now there should be no confusion that this is the head of talus. Now anterior to the head you will have this bone, and which bone is this? This is the navicular. So this navicular has to be very clear in your mind. Once you are clear to this, you can identify the remaining bone. Clear? Because just next on the lateral side, what bone is this? I just told you this is your this bone. What is that? This is cuboid. Clear? And anterior to the navicular you will have three cuneiform which are here. So these are the important questions which may be asked from this X-ray slide in your exam. So by this we finished the today's session based on the X-rays of upper limb and lower limb. I hope these questions will definitely help you in identification as well as to reply in your university vivas. Thank you and bye bye.